In this last part, I am going to go through specific parts of the body and go through some roots relating to those. And when you do see an image, these were images taken from the Commons site of Wikimedia, and they were labeled for reuse. So, except for this one, this was an image provided of me by a student. So, cephalic relates to head, neuro relating to the brain and nerve function, naso and rhine to the nose, and olfact like the olfactory bulb to smell, oro or oral to the mouth, gusta to taste. So the medical term for taste is gustation. Optic or opthal or oculo to the eyes, ori or otto to the ears. And so if someone has inflammation of their middle ear, they have otitis media, media being middle. But audi relates to hearing, just like audio is sound. So cervic is the neck, and one other use of cervic apart from this part of you, so cervical vertebrae would be the other vertebrae in your neck, but the womb has a neck-shaped, neck-like opening, and it's called the cervix because of cervi. Pylo is hair, and while there's skin not just on your face, there's skin all over your body, but I just thought I'd mention skin here. It's derm, and if someone has a hypodermic needle, it's a needle inserted beneath the skin. Pulmonary relates to the respiratory system. Pneumo or spiro relates actually to the lungs themselves. A spirometer measures lung function. You can have pneumonia, which is a very bad infection of the lungs. The throat in medical texts is called the pharynx, and pharynx is we use for throat. So pharyngitis is a sore throat. Broncho for the airways, like here. And when you're talking about the airways which are actually embedded in the lungs, a bronchodilator is something an asthmatic uses to make those airways larger when they're having an asthma attack. Now, as you can see, each of the lungs has this lining, and what you can't see is each lung is actually surrounded in a cavity which is lined with this wall here. And the cavities are called the pleural cavities, and the membranes are called the pleura, and that's a specific term for these. While we're in this region, the ribs, when you're referring to ribs, you say costal. And for example, there are muscles which join each of the ribs together, and these muscles are involved in breathing, and because they're between the ribs, they're called the intercostal muscles. Circulatory relates to blood flow. Vascular or vaso or even angio are blood vessels, so you might have had vascular surgery or cerebrovascular incident, the medical term for a stroke. Viagra, the drug Viagra, is a vasodilator, which means it causes the blood vessels to dilate, particularly the blood vessels in the penis. Angio is also a word for blood vessel, as in angiogram. Cardi, I've gone through before. This is a special one, coronary. It relates to the blood vessels of the heart, because the blood vessels of the heart are arranged in a very special network. And if you just took them in isolation away from the heart itself, they're shaped like a crown. And so they're called coronary. Heme as a prefix is relating to blood, but emia as a suffix also relates to blood. So hemoglobin and anemia or leukemia. Alimentary, the food nutrition. Gastrointestinal digestive tract. Teeth for denti, like a dentist. Lingual, the tongue. And some drugs are given sublingually, that is beneath the tongue. Hepato is the liver. Coleo is the gallbladder, which sits underneath the liver. And cholestasis is when the contents of the gallbladder, which is bile, can't drain properly. It stays where it is. Now, gastrointestinal relates to the digestive system, and people will say that I've got a bout of gastro, meaning they've got an infection of the gastrointestinal system. But gastro can also be very specific in relating to the stomach. And in fact, the distinction is made between gastro, which is the stomach, and celo, which is the intestine, like celiac disease. And fec for feces and the release of the feces from the body. Whoops. Renal relates to the urinary system. Neph is the functional unit of the kidney, and each individual unit of the kidney is called a nephron. And if the kidney is inflamed, we say nephritis. The bladder, we use the word cyst. This is where the urine is stored before you go to the toilet. And you'll see the ureters and the urethra, and in fact urine and urination, all have this same root. So you can add, again, you can have it as a prefix or as a suffix. Sticking with the urinary system, I want to talk about a couple of terms which aren't just used in the urinary system, they're used wherever you're talking about an organ. And I'm just using the kidney as an illustration of that. So the cortical part of an organ is the outer part. The medullary part is the inner part. The parenchyma is the functional tissue, and the stroma is the bits that hold the organ together. Musculoskeletal, my for muscle, arthro for joint. So arthritis is inflammation of the joint. Rheum is sort of like a sub-category of arthro because it relates specifically to synovial joints. So a rheumatologist looks at inflammation of those joints. Os or osteo, the bone. Chondro, cartilage. Cartilage is like what you'll find in the gives most of the shape to your nose. It's the stuff which joins your rib to your sternum. You find it in your joints, like the knee joint and the elbow joint. Adipo relates to fat, which you'll find not just in the musculoskeletal system, but in other parts of the body. And myelo. Myelo is a really confusing one. It's used for two quite different things. So the bone marrow, you can use myelio. And an example of this is a thing called myelodysplastic syndrome, which is where the bone marrow isn't working properly. But it's also used when we talk about the spinal cord. And that's pretty much it for this series, except to mention a couple of things. That what you'll experience when you're using medical literature is some terms have different spelling depending on whether you're looking at an Australian or a UK source or anything from any of the Commonwealth countries. These are countries that were once colonies of the United Kingdom, and that's contrasted with spelling used in the United States, and you can see some examples here. Though one which often people make a mistake is fetal, which relates to the fetus. There really is no O. Now, if you're looking at this lecture as part of resources on UTS Online, you'll see that there's linked to this in UTS Online. There's a quiz you can do to practice your knowledge of understanding medical terms. And with that, I'll leave it.